Finding reliable transportation is an issue for many North Carolinians. We'll tell you why. I'm Anita Brown-Graham. This is NC Impact.
NC Impact is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.
The lack of reliable rural transportation can be a crisis for some families. Hertford and Bertie counties have developed an on-demand solution.
Years ago I had a car accident and I couldn't turn my head. I had to go to a chiropractor, and then I developed a paraesophageal hernia, and I found out that was from the accident where it cracked my diaphragm. And I'm healed from that, but then I had a series of cars that were really a problem. It's very expensive. The last car I had, somebody come and tow it away.
A lot of patients and a lot of people in the community, they have to pay for rides. They have to pay their neighbor, their friend, and it can get expensive. HHMA trip, like we call it, for Hertford Health Maintenance Alliance. It was a program that was developed by community stakeholders, hospital, community health center, and we saw a need in our community centered around a barrier of transportation. We know this is an issue that not only impacts our community, but communities across North Carolina, across the nation. And we wanted to have a solution to this problem, but we wanted to make sure that our solution was tailored to the patient. So we worked with the local companies around the area, and we put them into our system so that we can transport our patients using our own community resources. We got our grant funding from Ronald Chawan Foundation. Our patients get transported for free of charge. The patient don't pay anything. We've been in this pilot program for a year and a half, going on 2 years, and we've seen some remarkable things happen for our patients, and we are very proud to make a difference in their lives.
I've been using the program for about a year, and it's been really a lifesaver for me. It's been great. I've been working out, and I've lost 10 pounds. It takes out the worry of trying to get somewhere where you don't have the transportation. And it's just been really helpful to me.
A new pilot program in Hertford and Bertie counties is proving to be a critical service for people who do not have access to a reliable vehicle.
You don't have a ride for tomorrow?
This is Shonoke Public Transportation Authority, and we are a transportation provider for a 4-county area, which is Bertie, Hertford, Halifax, and Northampton counties. It's basically on demand. We do not have any fixed routes in a rural area. So it's the demand of the transportation. We have routes that are formed in every county. Some counties have more than one route. We're not a one-on-one provider. We operate vehicles that are from 10 passengers up to 20 passengers. The senior population, sometimes get to a point where they are not able to drive. So we are here, to help those out that, if they need to go to a medical appointment or if they need to go. A lot of them go to senior nutrition centers throughout the county, so we take them there as well. And shopping. Some nutrition centers, give shopping trips to pick up some groceries and things of that nature, so, we provide that as well.
From, going to doctor's appointments, to the gym, to dialysis, and, like with dialysis treatments, you have to have that or else it can, cause your health to fail quickly. So being able to provide that to patients that need that is very valuable.
One, I would say for us, is our dialysis patients. That is a vital need to get back and forth to the dialysis center. Usually a patient goes at least 3 times a week. So that is, that's a vital need.
Reliable transportation is more than getting a ride to the doctor. It can make or break a person's chance of getting a job.
There's people that cannot get to work. We've had calls of people that had gotten hired, but because of lack of transportation, they would not accept the job.
And then you see people standing side of the road trying to catch rides, and your heart just go out to them.
Transportation rises to the top in rural areas very clearly. So we began to think, what if we did our own kind of local Uber? We have local transports, local taxis, Mom and Pop Taxi and a couple of other organizations. What if we were to design a program that it was Uber style and work through our case management here so that it was someone coordinating that and utilize transportation for our highest need patients.
The name of our business is Hinton's Employment Transportation Service. It's very important to our riders that they know they can depend on us. And we make it a practice to be reliable. The cost of it is not expensive. It's not a large sum of money. By way of grant is the way that we are being paid for it.
The key seems to be able to be on demand, have it not be just limited to coming to the medical visit, and how it can support that patient's lifestyle. It's really about not just those who walk in through our doors, but the impact on the community, financially, emotionally, spiritually, equity-wise, and how do we reflect that we're right here? You are who we are.
It would be wonderful if this transportation piece would expand and that others will model after it, because it will help so many people. It will help so many people.
Learn more about NC Impact's quest to find collaborations in action across North Carolina. Visit unctv.org/NC Impact.